So I'm Bernie Divall. I'm a research fellow in maternity care here at the university in midwifery. I'm a midwife by background, but now I work fully in research on the 12th floor. So you can come and see me anytime if you're interested in research. I'm going to talk to you a little bit about Notts Maternity, which is the Nottingham Maternity Research Network, and that you have a link to as part of your blended learning activities. But I thought I'd give you a bit of background to it because it's kind of one of the things that I've been involved with since I've been working here over the last few years. So service user involvement, which you'll see from the other resources that you've got in your blended activity, is a very important part of research, and it's something that researchers have come to think about in quite recent years. And it comes from the idea that research is to be done with people rather than to be done to people. And so trying to involve the people who will benefit from research within that research is considered an integral part of all research planning now. And if you ever go into research and you find yourself looking at a funding application form, you'll see that there is always a section where you talk about how you're going to involve service users in your research and how you're going to do that and why. So we established Notts Maternity back in 2014, and the reason that we did that was we were very keen that women who had accessed maternity services locally would have input into the type of research that we do here. And we wanted to be sure that they were having input at every part of the research cycle. So you'll see from the work that you're doing at the moment around writing a research proposal that there's a very large cycle of things involved in undertaking a study. And the idea is that service users should be involved at every point in that process. So that includes, for example, if we're thinking about birth plans, which is one of the areas that I've been studying in the last few years, we think about what do women think about birth plans? Well, how do we go about finding out what women think about birth plans? And how do we go about finding out whether the birth plan really matters to women anymore? Or is it something that was, a really big deal in the 1980s and the 1990s, and actually they're not that bothered about them anymore? So what we do is we ask people. So what we wanted to establish was a group of people who we could go and ask questions to. And we were very keen that this group of people would be very diverse, representing our local population, with a range of backgrounds and interests, and to make sure that we were on the right track with the kind of research questions that we were coming up with. So we had we literally started from nothing. We didn't have much of a framework because this is not something that has really been established yet within maternity research. So we use literature from places like learning disability and mental health research, where service user involvement has been pretty standard for quite a number of years. And we took principles from there, and then we literally hunted down some women who had been involved in maternity service audits via the supervision model. And we wanted to talk to them about, why had they got involved in that kind of thing, and what was their reason for being involved. And if we could get to the bottom of that, then we might think about how we could then engage with people in the context of research. So we had about 4 women that I spoke to on the phone, and then they came to the university and we had a bit of a lunch and a chat about the kind of things we were planning. And literally from there, we've kind of built up very gradually. It's taken us about 3 years. We now have about 105 women on our mailing list, which is fantastic because it means that we have access to a wide range of opinions. That process has been quite complex and detailed and takes quite a lot of my time, where I go into community settings to go and speak to women rather than expecting women to always come to us, because that's a key part of engagement with the community, is to go out to the community rather than having this expectation that people will happily come to a university. And we've been very clear as well about our clinical backgrounds and the fact that we're generally midwives by background, because that matters to women, because I think that sometimes the idea of engaging with a university can be quite scary and daunting. To that end, we have regular meetings about every 3 months, and we have those meetings often. We used to have them here at the Tower, but actually we more often go out into the community. There's a pub called the Poppy and Pint in West Bridgford. It's got a lovely dining room, and we often take our meetings there. And we have a meeting every 3 months, and in those meetings we discuss lots of things. So it might be that we talk about a study that's ongoing. It might be that we've got an idea for a new study and we want to make sure that women think this is relevant. It might be that somebody from the broader School of Health Sciences wants to come and ask women what they think about a particular thing, so we invite other people in. It's been really good to see this evolving, because one of the main things that's been really lovely has been seeing the relationships that the women form between them. And because we have this mailing list now of about 105, when we have a meeting, we have normally between 10 and 15 of our network members that come to those meetings. And they have formed quite a relationship with each other. So they're now getting to know each other quite well. We find that some people are heavily engaged in studies. Other people just want to come to the meetings. A lot of people just have our regular newsletter, which goes out every 3 months also in between the meetings. And that is for people who can't get to meetings or who don't want to come to meetings, but just want to have an idea of what's going on in our kind of research field. And we get a lot of positive feedback about that newsletter. And when you go to the website to have a look at that, you'll find all of the newsletters up there, including the latest one, which I will have put up by then. We find that women who have used services bring a huge amount to the research that we do. And given that women have very busy lives, these are often generally women with young families, we have a kind of a wax and a waning approach to involvement. You'll see that women will become very interested in at some points in their lives, and then they have a second baby and they obviously don't have the time, so they're maybe less engaged. Our meetings are generally very lively because they involve babies and young children as well, and we like to have as many babies as we can around the table. Generally speaking, we've had probably 6 or 7 women who have been really quite heavily involved in the research that we've been doing. And that involvement has taken many forms, really anything from just giving us some ideas and feedback about what they think about a study proposal, right along the line to helping to do data collection. So, for example, the study that Dennis Walsh has led about midwife units, some of our service users trained to do focus group interviews, and then they were the facilitators for those sessions. And that was really valuable because, of course, as women who have used services, engaging with other women who are using services, they have very particular understandings and conversations that a researcher might not have, or a different agenda that, we might miss something that they're picking up. So we do find all our service users fantastically valuable. As I've said, it's a very positive environment that they come to, and hopefully we will just continue to grow. And I hope you enjoy the website, and we'll have further discussion about service user involvement when we meet in the session.